Sex during pregnancy. Sexual functioning is a complex interplay between biology, physiology, and psychology. Veins, arteries, nerves, genitals, breasts, and nipples, as well as an array of hormones, neurotransmitters, and other physical components play important parts in the functioning of sexual activity. Sex is among the top most enjoyable activities practiced by couples. Why should this be any different during the 9 months of pregnancy? Many expecting parents have concerns about having sex during pregnancy. It is important that you nourish your relationship as much as you nourish your unborn child during pregnancy. Most women find that their bodies grow large and unwieldy during pregnancy. Many women are surprised to find that their sex drive actually increases during pregnancy, particularly during the second trimester. This is due to the increased amount of blood that is coursing through your pelvis and vagina. Is sex safe during pregnancy? Sex is safe during pregnancy provided you have a low-risk pregnancy with few complications. Your doctor will let you know if you should avoid sex for any reason at all. Most women can enjoy a healthy and fulfilling intimate relationship throughout their pregnancy, right up until their delivery date. Will I enjoy sex during pregnancy? Surprisingly, many women find that they are more sexually aroused during their second trimester than they were prior to pregnancy. The increased blood flow to the vaginal and a woman's growing bosom often results in a heightened sense of self and sexual arousal. Most women will shy away from sexual relations during their first trimester when morning sickness and fatigue often get in the way of lovemaking. During the third trimester, some women find themselves uncomfortably large and prefer not to be intimate, whereas others continue having intercourse right up until they go into labor. Will sex hurt the baby? One of the most common concerns of fathers-to-be is that sex will hurt the baby. Some men are afraid that they will bump into the baby when they have sex. By and large, however, this concern is unfounded. If your husband is overly concerned about having sex during pregnancy, have him join you at your prenatal visits. A little reassurance from your physician that he will not hurt or bump into the baby may be all your husband needs. Partners often react very individually when it comes to sex and pregnancy. While some men find the sight of their wife's blossoming body a true turn-on, others are ambivalent or even a little turned off by pregnancy. It is important that you are open, honest and communicative with your partner about your needs during pregnancy, and try not to take any emotions your partner may be feeling personally. Remember that pregnancy is often an emotional roller coaster, and your husband or partner may be more concerned that you might react differently, or may be scared of the idea of having a family in general. Some men have a difficult time being intimate with their wives even when they recognize that they will not harm the baby, because they feel another presence is in the room. That said, many men and women have remarkable sexual relationships throughout their pregnancy. Even if you do not engage in intercourse with your husband, it is important that the two of you work on nurturing your relationship throughout your pregnancy. Foot rubs, kissing, back rubs and holding hands are all excellent ways to share some intimacy without actually engaging in intercourse. The best way you can ensure that you and your partner remain close during your pregnancy is to check in with your partner on occasion. Inform them of your needs, let them know where you are coming from and what you need or want from them. Positioning: if you and your partner are interested in maintaining a healthy sexual relationship during pregnancy, then undoubtedly you must be wondering what positions will work best for you as your belly grows and expands. The best thing you can do during your pregnancy is keep an open mind and be creative. Most women will find that it is uncomfortable to enjoy sex in a missionary position after about the first or mid-second trimester. Try flipping over, woman on top, and even lying next to one another during your pregnancy. 7 tips for a healthy pregnancy. It is always important to take whatever steps you can to be healthy, but while you are pregnant it is even more important. Not only do you need to take good care of yourself, you are also profoundly affecting the life of another person, your baby. Here is 7 tips to help you along the way. 1. If you smoke, one of the most important things you can do is to stop smoking. Babies born to mothers who smoke have a lower average birth weight, are more likely to be born prematurely, and are at greater risk of death from sudden infant death syndrome than babies of non-smokers. Sometimes mothers feel having a low birth weight baby could be an advantage as it will make the baby easy to deliver. This is not necessarily the case, as it may lead to an emergency delivery, which can result in all sorts of complications. Even if you are already pregnant, stopping smoking will benefit the baby for the rest of your pregnancy. It is not only the baby who benefits. You are likely to suffer from less morning sickness, experience fewer complications and have a more contented baby after the birth. 2. It is also important to pay attention to your diet. Research has shown that women only need an extra 200 to 300 calories a day while pregnant, and you may be eating those extra calories anyway. What is important is to ensure that you get the protein, vitamins and minerals necessary to build another human being. Those extra 200 to 300 calories should not be squandered on chocolate or crisps, but should be eaten as fruit, vegetables, etc. It is also important to increase your water intake, which will help avoid constipation. 3. It is generally a good idea to take a good quality multivitamin and mineral supplement too. There are now ones specially formulated for pregnant women. Ideally these should be started before you become pregnant, so that you are in the best shape possible for the pregnancy, and then continued throughout your pregnancy. An adequate supply of vitamins and minerals is important right from conception. For example, a deficiency of one of the B vitamins, folic acid, in the first month of pregnancy may lead to the baby being born with a cleft lip, congenital heart disease or spina bifida. Omega-3 fatty acids, obtained by eating oily fish, flaxseed oil, walnuts, spinach and spirulina, or taken as a supplement, are important for the development of the baby's eyes and brain. Omega-3 also reduces the risk of premature birth and postnatal depression. 4. Nobody knows how much alcohol it is safe to consume during pregnancy, so many health experts feel it is better to avoid alcohol entirely for the sake of the baby. This can seem hard on the pregnant woman when everyone else is drinking, but it is important to remember that alcohol is a poison for the growing baby, and no caring mother willingly gives her baby poison. 5. Pregnancy is not a time to sit still. Although adequate rest is vitally important, most experts believe that healthy pregnant women should be taking 30 minutes of moderate exercise every day. 6. It is also important to minimize exposure to toxic chemicals while pregnant, so spending a lot of time painting the house and laying new carpets is not a good idea, especially in the early stages of pregnancy when the baby is particularly vulnerable. 7. Many women find pregnancy stressful, and this can be a particularly good time to turn to safe, non-invasive options such as Bach flower remedies, homeopathy, kinesiology and other therapies. Making a new life is something miraculous. Doing the best you can for that new life starts long before you have the baby in your arms for the first time. One of the best things you can do for yourself and your unborn child during pregnancy is exercise. There are numerous studies that show that women who exercise during pregnancy are more likely to have easy labor and deliveries and faster recoveries. Here are just a few of the benefits associated with exercise during pregnancy. Exercise helps combat fatigue. Exercise helps minimize back pain because it helps strengthen back muscles. Exercise can help promote a smaller amount of fat gain during pregnancy. Exercise provides an exceptional form of stress relief. Women who exercising during pregnancy are less likely to experience difficult labors. Women who exercise during pregnancy are more likely to return to their pre-pregnancy weight faster and recover more quickly after delivery. There are some forms of activity that are better than others during pregnancy. Certain exercises can help promote physical fitness and are less likely to result in injury. Among the best exercises for pregnant moms include walking, swimming, stretching, yoga, Pilates and dancing. Wishing you well, and I hope you will enjoy sex during pregnancy.